So, hi everyone, welcome. This is the first event in Petminded's fall series, Acupuncture for Dogs. I think this is a really cool topic, and I know in the Petminded community, people have always had a lot of questions around this. I personally have a lot of questions around this. I first became acquainted with acupuncture for pets when my kitty was in her end of life stage, and we kind of did some work for pain and so forth. And that was my first intro, and just seeing the difference it made for her was so great. So hopefully we're going to learn a lot today about this modality and how it can improve quality of life for our pets much earlier, even though obviously end of life was very beneficial. So I'm going to give you a very quick intro to Dr. Berg. He has a Bachelor of Science degree from Cornell and his DBM from Kansas State University. And he completed his acupuncture training this year, actually, at, do you call it Chi University in Reddit?
University. Yep, Chi University.
Anything that you would like to tell about us, Dr. Burke, before we kick things off?
I'll give it a little quick story on it. Acupuncture, even coming out of vet school a lot longer than I want to admit right now, was something that I was always interested in, but it is a big commitment to kind of go through the classes and the certification for it, which, by the way, they approved my paper last week. So I am now officially certified. It's something I was always interested in, but, had never got around to doing it. And once I started going to classes, I was having some kind of health problems that they couldn't figure out. I was having pitting edema in my legs. I had multiple ultrasounds, CT scans, all this stuff. And on the Western side, they just kept saying, well, it's nothing that's life threatening. We don't know what it is. You're just gonna have to live with it. And as a doctor, I was like, that's not an acceptable answer. Like, I'm not living with pitting edema in my legs when I'm a, otherwise healthy person. And so I did seek out an acupuncturist, and I went for 5 sessions, and sure enough, completely fixed that problem and has not recurred. And, I was a believer beforehand, but it is really something that is quite amazing. And we'll get into it more on the scientific basis of it and what's there and what's not. But it is something that I think people that want to look for alternatives really try to. And the people who kind of want to say, hey, if it doesn't have a pharmaceutical company behind it, then I don't believe in it. And so again, we'll get into this more, but it is something that I think you're all interested, because that's why you're here on Monday evening. But it's something that's really interesting, and I really, really like it. And I think it is something that by itself, it can do wonders. I really believe in the integrative approach, where you can take Western medicine, you can take Eastern medicine, put them together, you're going to get better effects than you would with either one of them by themselves. So I hope that comes across, but it is something I really believe in. And I do think that is something can be really helpful for a lot of our pets.
Amazing. So let's kick things off by, I think you already started going down this path. So this is an excellent segue. Just the roots of acupuncture. I mean, I think we all kind of have a sense that it's like been around for a very long time, but also I'm curious when it started to become more prevalent with Western medicine, like as a complementary modality. If you could share that, that'd be great.
Yes, I'm going to use some notes on, because it's a lot of history stuff. I will not get into it crazy. I'm not trying to lecture you on a history lesson, but it's just some stuff that I think is really cool. A lot of what we've kind of figured out as far as when it started is actually based on a lot of archaeology. As they dig up artifacts, they find things like, oh my God, what is that? And then all of a sudden they realize it was the first acupuncture needle. And so really when it started was, you can trace it back to the Neolithic period in China, which is basically the Stone Age 8,000 years ago. And they did find these stone needles. So they kind of had sharp points and rounded edges. And when they kept finding them, they were like, oh my God, these were acupuncture needles. And so really, really cool way to do it. It then progressed at that point, and again, looking at what they can kind of uncover, and you start going into bone needles, which is basically from the Stone Age until the Han Dynasty, which basically becomes AD 220. And so these were made out of bones, so probably animal bones in all honesty, where they basically would sharpen them and then use them that way as well. From there, you go to bronze needles, which basically matured in the Shang Dynasty, which was from 1600 to 1100 BC in China. And this was one of the periods where it was really considered that the Chinese were able to really fine-tune a lot of medical tools. So now they were made a little bit more consistently, a little more precisely, so they were a little stronger. From those bronze needles, you had different versions of them where it even goes all the way up to 221 BC. And then in unearthed in a Han tomb from 113 BC, you start seeing gold needles. So they literally made needles out of gold. And it is something, when you talk about gold, it is considered a little bit more pure, a little bit more conductive, especially if you're doing electroacupuncture, which again, we'll get to a little bit later. It is something that is supposed to help stimulate those points a little bit better. So something really cool. And these are the basis of what some of the gold needles we have now. Now, the gold needles we have now, they're not pure gold, obviously, because that would be a very expensive tool. They're really gold plated, but they're really helpful. And then you kind of even could go back to metal needles in 3,000 years ago, gold and silver needles 3,000 years ago. But that's where you get to today, where you a lot of times have either stainless steel needles or gold plated needles, which are the most commonly used for acupuncture. Now, there are a whole bunch of different brands of them. So you can see ones with plastic tips, with metal tips, with gold tips. And again, they are useful based on what you're using them for more than anything else. From the animal side of things, it actually goes back much further than you think it does. There were basically books and history showing that they were using chemoacupuncture, which is injecting blood into these points between 947 and 928 BC. And really was horses were the main things. And there's a whole bunch of books. There's some really early Chinese books where acupuncture started. Again, not going to read the names because I would butcher them and I don't want to disrespect anyone like that. But basically long Chinese names of acupuncture stuff there. But really, when you talk about from an American standpoint, it was really in like probably 1971 that you saw the prevalent use of acupuncture starting in dogs. Before that, there may have been people doing it here and there, but that's when you saw it a lot. And the interesting thing that happened around that time was Richard Nixon went to China. And so Richard Nixon went to China to visit a political mission, and Henry Kissinger came with him. One of the his assistants for Henry Kissinger was this guy named James Reston. And he was in China, and he had to get his appendix removed. And he was having excruciating pain after this surgery. And really, they were giving him pain medications, nothing could work. And they're in China. So he actually went and saw an acupuncturist. And from this acupuncturist, they did 20-minute treatments. And all of a sudden, he was fine after that and never had any recurrence. And this was written about in history where they talked about it. And from that point on, especially in America, you had this increased amount of interest in acupuncture, people actually using it, and actually an increase in the amount of literature being written about it, basically peer-reviewed and published articles on acupuncture. So we can actually credit Richard Nixon for something good at this point and saying, okay, he helped bring acupuncture to the United States of America through one of his diplomatic associates. This is where we did start to see a lot more interest in it. And there was still, especially on the Western side, you would still see a lot of people saying, oh, it's all voodoo, it's all non-scientific medicine. And then more and more studies were being done. And to the point that finally the NIH was seeing all these studies, that the NIH finally released a statement and saying acupuncture is a accepted modality to control pain. And so that's a big thing, saying that, hey, there's a good pain control aspect, to the point now that with the opioid crisis, there is actually this push. More Western medicine doctors should be using acupuncture instead of opioids, because they think you can control a lot of the pain people have without the addiction to opioids, because they're actually stimulating the same receptors within the body. And so it is something that's really cool. Now, there have been a lot of papers since then, a lot of research since then, and the NIH probably has enough information to probably say acupuncture is an accepted modality for other things, but they've never gone down that road. There's a lot of talk among people and controversy saying, why does that happen? I'm not going to get into that. I'm not going to say it's some big conspiracy, but there probably is a lot more data there that the NIH could turn around and say acupuncture is accepted for different modalities, but they just haven't done it. But the one thing that they will say left and right is for pain control, they have scientific proof that it does work. That's where we are at this point. From a human perspective, it is actually a subspecialty. So on the human, in the human side, you actually have to be certified in acupuncture. You can't just do it on something else. There's actually licenses for every state. There's certification for most human acupuncturists. They actually have to do apprenticeships for multiple years to get the certification on it. In it. From the veterinary side, there are now multiple different programs to get certified in acupuncture. I don't want to dive into the next category, but I guess I can talk a little bit. And so when you talk about from the veterinary medicine side, there are programs like the one I took that take true Eastern medicine. And so you're looking for pattern diagnosis. And again, without going into a lot of boring stuff that becomes very complicated, you talk about yin, you talk about yang, you talk about interior versus exterior. And then that's how you kind of come with your diagnosis, which then helps choose the points you use to treat stuff. There are also programs that do it a little bit more, taking the Western diagnosis and saying these are the points you can use for that. There are pluses and minuses to both of them. And I think we'll talk about that towards the end of the talk. But that is kind of where we are now, and that's where we go. I know it's a little, if you're not into history, maybe not as interesting for me, but I'm kind of dorky. So I kind of like the fact that this has been around for a while and actually a lot of information on it. But I apologize if it's a little too dorky.
No, this is great. I'm just going to take the liberty of speaking for the pet-minded audience.
Sure.
Everyone here, even if they're not dorks in life, like they're generally nerds about their dog. That's why they're here on a Monday. And I think we're pretty proud of it. This is great. This is super helpful to set context and also some fascinating stuff. I had not anticipated a lot of this. So thank you for sharing. I guess the follow-up is, and you already start talking about this, but really, what is understood to be the science behind acupuncture? Because we're seeing a lot of evidence that it works, but do we understand the mechanisms that underlie that?
But this is something where they've really trying to figure out, it's like, why is it? Now, obviously, when you go back to, 3,000, 8,000 years ago, they figured out that, hey, if you have a abscess and you lance it with a stone needle and it drains, you get better. And I think that's where it really started, is they realized, oh my God, certain things, if you cut them or kind of open them, they drain and they get better. And what they started to realize, that certain points on the body, when they would touch, they would see systemic effects from it. And they didn't know why. They just realized you hit it, like you hit this point and all of a sudden this feels better. And that's what it was. And as time has gone on, and now we have a lot more technology, and you start to kind of figure out what is actually the cause of this, because as you start seeing proof of it, a lot of it is based on whether you want to take one frame of reference where you have electromagnetism. If you take a reader, and this is not a tool that any of us have, but if you measure electromagnetism across a body, as you come up to acupuncture points, those levels rise. And so the reason is there's a lot of energy being used and stored there in the course of the body. What really happens from an anatomy perspective, if you look at acupuncture points and you are on an, obviously not in a live animal, but on a dead animal or dead person, dissect down at those acupuncture points, you're going to find bundles of nerves and blood vessels. And so that is why we believe it works, is by stimulating those certain areas, they are spreading to other areas, which is why you have those effects. And so realistically, that's what it is. Did they understand that when they started doing this? Absolutely not. But it is something now when you look at it and you can map every acupuncture point on the body, whether it be a person, whether it be a rhinoceros, whether it be a dog or a cat. And sure enough, when you kind of look at these points, you see it. But this is also why acupuncture, when you're, at least on the veterinary side and even on the human side, you're taught to look for landmarks. And that's how you're trying to find these spots. But everyone's anatomy is a little bit different. And so if you have an injury that all of a sudden some of your bony prominences have moved because of surgery, they start to find those acupuncture points move as well. And that's because those bundles of nerves and vessels tend to move as that stuff moves. But that is why when you're looking for it, you're kind of looking for very specific spots, and then you feel. And so we're always taught, and human nature is, I have to feel something that I shouldn't feel. You press like this. You'll never feel it that way. It really is light, gentle pressure. You get the frame of reference where you are, and then there are usually holes, for lack of a better purpose, because all these things really lay on either on peaks or valleys of some of these bony prominences or some of these muscle bellies, and you're able to feel them. So that's really the basis of it, is you're looking for these points that will stimulate other points because of nerve conduction and blood flow.
Wow, that's so interesting. I think my follow-up question was going to be, actually, because you were talking about looking at various animals and dissection and so forth. Has acupuncture been used for a variety of species? Because I know we're talking about dogs today, but I know, and you mentioned horses earlier, but
yes, so you can actually use it. So the ones that are used all the time, horses, a huge one, dogs, huge one, cats, huge one. And just like everything else in veterinary medicine, cats are not just small dogs because they actually sometimes have different acupuncture points because their anatomy is a little bit different. Birds are big ones that they use. I will not, but that people do use them on birds. There are for exotic animals points. And the gentleman who's in charge of the university, he is he's the most published veterinary acupuncturist in the world. And he will tell you stories like he goes to do elephants. He goes to do all these other exotic animals because you have these animals that have problems and they're looking for alternative medicines. And so it actually is there for everything. Now, a lot of the anatomy is the same, and the way we correct for it is, and this they do the same thing in people, is me and the person next to me may be different heights, maybe different widths, may have different arm lengths. And so you don't just say it's here. You actually have a correction factor. So you have an anatomy point and you'll say, okay, between the tip of the shoulder and the elbow, they need a Chinese term, it's called Schwinn. It's spelled C-U-N, okay? And you'll say, this should measure 9 Schwinn on every single person or animal. And so when you try and figure out that acupoint, you know it's 3 Schwinn from here. And so that corrects for the size of the animal, the size of the person, and then still being able to find that point. And that is why it works, not just saying, oh, it's right here. Because on me, it might be right here. On you, it might be right here. On Terry, it might be right here. But for Ingrid, it might be here. But there is that correction that as an acupuncturist, you're not necessarily looking for a specific spot. You're saying, I can measure it, I can get to the area, and now I can feel the spot. Because if you were off by 2 millimeters, you may not feel that depression. But if you're able to now correct for that, for whatever the size of the person or the patient is, now you're going to be in the right area no matter.
It's really interesting. Actually, that was something that, when you said cats are not small dogs, I think that's such a relevant point, not just for acupuncture, but for a variety of things. And Ingrid actually has a question.
Ingrid was asking, are there things that's contraindicated? And so the short answer to that is no, with a caveat of there are certain points you wouldn't hit with certain conditions. And so to simplify that, because I know that sounded like very vague and very complicated, but you would never needle into a tumor. Acupuncture actually stimulates blood flow, and you don't want to bring blood flow to any type of mass or tumor. So you would never do it there. That doesn't mean that animal can't be acupunctured, because even if the problem is here and there's a huge tumor, you can use a distal point, something that's further away, that can still innervate and interact with that spot without then stimulating that tumor. The other things you do is that if you have a patient with seizures, you're not supposed to use electroacupuncture. And again, we haven't got to that yet, but we'll get there. And that's because you don't want to put electricity into that because it can stimulate seizures. You don't want to acupuncture or electroacupuncture across a diseased heart. It doesn't mean you can't use electroacupuncture in heart disease, but you don't want to go from here to here because then you can cause some damage to it. If you're talking about the actual acupuncture, there is nothing it's truly contraindicated in, but there may be specific points or certain modalities you don't use depending on the condition. And so without going into more specific detail, I hope, Ingrid, that answered your question. But yes, you can use it for anything. You just may not use the point that's closest to the area because of something going on there.
If you can tell us a little bit about traditional versus electric. Yeah.
Yes, there are really 4 types. One of them probably doesn't get used that much, but you first have dry needling. So dry needling is what most people will have done if they go see an acupuncturist. This is when you take the needles, you basically put them into a spot, you leave them in, depending on the age of the patient, how vital they are. That time could be from 8 minutes to 20 minutes. It really just depends on, what you're doing for that. And so that would be dry needling, where you hit points. Typical acupuncture section in an animal is probably going to be somewhere between 30 and 40 needles. That you go from there. Dry needling is very effective, but it also has the shortest mechanism of action. So dry needling may only have an effect for potentially 3 to 5 days. The next step up from that is what we call acupuncture. Acupuncture is still hitting these acupuncture points, but you're using some type of fluid, and that's why it's called aqua. Most of the time, most people are going to use vitamin B12. And the reason is vitamin B12, A, is very safe in that if you give extra vitamin B12, the body just pees it out. So you don't have to worry about holding it. Number 2, it is a little irritating, especially when you put it underneath. And so because it's a little irritating without hurting the patient, but it will irritate the kind of nerve a little bit, you will get a prolonged effect on it. And for acupuncture, you can see effects sometimes between 5 and 7 days. Then you have electrical acupuncture. This is still using those dry needles, but now you're hooking up electrodes to the tips in pairs. And when you do electroacupuncture, it always should be a pair because you have to complete the circuit. And then you're putting electrical current through those basically points for a reason. You're not just randomly picking them. The acupuncturist is going to put them together to basically accomplish something. But those can sometimes last up to 3 weeks effect. And then you also have hemopuncture. Hemopuncture is actually taking blood from the patient and actually injecting it into another spot. There are local spots you can use it in because it also stimulates and irritates it. The most common place in dogs or cats they'll do it, there actually is a point right here, stomach 1. And for some eye problems, you will inject hemopuncture there and go from there. But the reality of hemopuncture is also removing blood from the body. And so if you basically hit a point on tip of the ear, point on tip of the tail, if you have excessive heat, you're trying to remove some of that. And so that's really how you're going to do that. The hemopuncture, you're really only using for heat stroke patients, stuff like that. But it's something that can be used in other situations where they're not necessarily acute emergencies. You had a really high fever, you can do here, you can do the tip of the tail on a dog. Again, you're still not using a huge needle, but it's really just punking through to like drain the blood. That's where you do it. Now, what you use is really going to be based on what the acupuncturist feels is in the best interest of the pet. Sometimes it's a patient cooperation. Those dry needles have to stay in place for a little bit. So if you have a really scutchy, nervous dog that's kicking and doing this, those dry needles, you will get an effect as soon as you put it in. You can put them in and you still will get an effect, but if you don't leave it in for a little while, it's not going to work. Electroacupuncture is the same way, is that usually you do a lower current and then you do variable current after that. And again, it's about keeping them in place. So it's patient selection. The acupuncture, as long as the animal is not trying to kill you, you can do it. We usually use permission or calming points to help with that. And on some dogs, we use one up here. We use one on basically on the lower back. These are things that can help the patient calm down a little bit. But if the dog is really aggressive, that's probably not going to be enough. You can use stuff like trazodone or gabapentin, which are anti-anxiety sedative medications, but they do decrease the effectiveness of the acupuncture by sometimes 25 or 30%. Now, 70% is still better than nothing. So if that's what you have to do the acupuncture, it's still fine, but something we look at there. Question that came in over the chat was, can you use the same principles on pressure, acupressure? And the answer to that is yes. Now, obviously with acupressure, you're not going to stimulate as deeply or as long, but yes, there are plenty of people that will do acupressure on acupuncture points, and you can still have really good effects on it. That kind of goes through the different types of acupuncture modalities you can be doing. I have been doing a lot more of acupuncture recently, just because, especially on these, like, no one loves getting stabbed by needles. Now, they're really small, but no one loves it. And so I do think electroacupuncture is really, really helpful in a lot of cases, especially a lot of dogs with arthritis. But it all is based on, can they stand or can they sit in one spot for a while? And these really, really arthritic dogs, even laying down, they're uncomfortable in one spot and they're going to keep flipping. And that's part of the problem. And so I have been doing a lot more acupuncture just because you only have to hit it for a second and I will get that prolonged effect. And I've seen really good effect on that.
When do you recommend acupuncture, and then who do you recommend it for? What type of patient?
So we'll go who first. That's really the patient selection that we talked about before. If this is a really aggressive dog and it's not the dog's fault, they're nervous at the vet, whatever it is, but if they're a dog that needs a muzzle, needs drugs, needs sedation to even get anything done to them, probably not a great candidate for acupuncture. Everything else honestly can be, including cats. I know this is mostly a dog one, but including cats. And so I don't think that there's any patient that you can turn around and say they would not be a good candidate for acupuncture. Again, as long as they're decent patient. They don't have to be great. Getting stabbed with a needle, they're really sharp, but they're really small. I have stuck myself with them. And it doesn't really hurt. It's something that's really quick. And so really okay. As far as conditions, you can run the whole gamut. there are definitely case reports where you can have something, arthritis is the thing that most people think about, pain and arthritis. And that I think it works great on. And again, going back to the NIH statement, they'll tell you it helps with pain control. So I think that's a really great thing. But when you talk about even internal medicine disease, like allergies, endocrine diseases like hyperthyroidism, hypothyroidism, Addison's disease, Cushing's disease, heart disease, kidney disease, these are all things that have acupuncture points that will help them. Now, if that's the only thing you're using to treat a dog with really, really end-stage kidney disease that's not eating, yeah, I'm going to be the first one to tell you, you need to do more than that. It's not just going to be that. But this can certainly be an adjunctive therapy that can help. And a lot of people look to these alternative therapies, whether it be acupuncture, whether it be Chinese herbs, whether it be some other things, only as a last-ditch palliative effort. And I would argue if they would try and look at some of that stuff earlier on, you would see a better effect, and it wouldn't just be a palliative effort for it. And so, like I said, going back to the beginning of the conversation, I really do strongly believe in integrative medicine. So I'm not one that's going to tell you, hey, we should stop every medicine and do this. But this is something that using as an add-on to some of those therapies, you are going to see better results than if you did only Western medicine alone. And I know this talk isn't about Chinese herbs, but even that I started to dive into a little bit. When you think about Chinese herbs, these are pure forms of some of the drugs that we have. A lot of the Chinese herbs, they were the original form that a pharmaceutical company then basically boiled down to its basic products and then kind of made it more. But a lot of the Chinese herbs can work in very similar ways or as add-on ways as well. But the acupuncture, I think, can be really helpful. So from the grand scheme of things, there is no condition where you can't say there aren't points for that. Part of it is going to be based on, is it cured by Western medicine? If it is, then you don't necessarily have to do it. But if it's something that's a chronic issue, I strongly believe in doing acupuncture for it because I think it can help. Big thing that my teacher said is, hey, most people that come in looking for acupuncture, they're chronic problems. They have dogs or cats that have been sick for quite some time. And he used to make a little joke. Did this start yesterday? No, I can't fix it tomorrow then. You really need to give it an opportunity to work. Really, the general rule on acupuncture is you need to give a couple sessions. If you expect to see an amazing result after one session, then it can happen. And I've seen a couple of them where it happens. But you're probably not giving it a fair shot if you're saying, hey, it didn't work the first time, I'm going to stop. In general, if you get to the 5th session and you're not seeing a result, then the answer is we either have to change something or maybe it's not going to work on this. But if you're going to commit to it and you're willing to do, I'm going to do 3 sessions, I'm going to do 5 sessions, then I think a lot of times you're going to see very positive effects.
Have you ever used it in a preventative fashion, supposedly for, a breed that, has a known issue?
I have not. Theoretically, could you? Yes. And I guess the argument would be made is if you have certain breeds that are prone to stuff, they probably have some signs of it to start with. And the big thing I always think about is bulldogs. Bulldogs, just because they're not having trouble breathing now, doesn't mean you don't see the nostrils that are messed up. You don't see the kind of elongated soft palate. You don't see potentially what we call averted laryngeal sacals in the back of the throat. And a lot of times for these breeds that are truly prone to stuff, it's because there's something there already. It is something where I have not done it that way. I have not read anything about doing it that way, but I guess depends on how you look at it. If you see something where it's really, really mild cases, where even from the Western side, we wouldn't probably treat it, that may be the right time to do an acupuncture treatment. And part of the reason for that is while the Western diagnosis may not fully be there, if someone did a full exam looking at the Chinese diagnosis, they may be able to have a diagnosis of there, and then you're actually treating that Chinese diagnosis. So not truly preventatively, but probably seeing it a little earlier from the Chinese side than you would from the Western side.
What is the most interesting case you've seen so far where acupuncture has been helpful?
So I have done lately mostly arthritis cases because, again, starting new patients, that's what people are like, oh, I want to try this, I want to try. In my classes and talking to the gentleman, Dr. Shea, who is the main teacher of it, so many things where it was crazy. He had animals in heart failure where the owner just didn't really want to go the Western medicine way. So even though the cardiologist said you should be on heart meds, they decided not to do it. Now, he didn't recommend that. He said, you should still be on your heart meds, but I'll try and do that. And then 2 years later, with just acupuncture, and then they ended up adding Chinese herbs, that patient was still alive and doing well. Same thing with some cancer cases where I've seen those from his case reports. It doesn't mean I think that you should stop Western medicine and just go to Eastern medicine if you have a true diagnosis. But there are people that have done that, for whatever reason, whether it be financial, whether it be beliefs. And there have definitely been positive cases with that. Most of the ones I've seen right now have all been either mostly arthritic cases that then they'll have like some separation anxiety. So I start doing points for that as well. And I've seen effects of it. Really, the sky's the limit on this. And I think it can be a really good treatment for almost anything.
And I just quickly want to underline one point that I think you made a few times. You were talking about integrative medicine. So this is not a recommendation to discard Western medicine and just go the route of acupuncture or other traditional modalities. You're saying the two work together.
Yes.
Because I think one of the things I've seen a lot of times is people will say, hey, if you do take this herb, you don't need to take your medication, right? Both for dogs and for humans. I've never really felt fully comfortable. And I think a lot of us don't feel comfortable just going off of our meds. It doesn't feel safe. This concept of integrating the two and then finding the right partner in your veterinarian and whoever you're working with to make sure that they work together is really critical. I know you've said it a few times, but it's a really important point that we sort of talk about a lot in our community, because it's not like Western medicine is bad or the opposite, right?
Yeah, and it's something where there are people, again, because of their beliefs, they have done just Eastern medicine, they can have very good effects. There are people that think that Eastern medicine is Huey and they only want to do Western medicine, and you can have really good effects. Really where you're seeing, I think integrated medicine should be there all the time, but where you really see people doing it is that one or the other failed, and by itself it wasn't enough. And then you start putting together, and now you not only see a patient that's doing better, you see a patient that's potentially thriving. And so I think that's a big takeaway here, is I think you can mix them really, really well. And again, where I took classes and I got certified, Dr. Shea is really big on that. He's the first one. This is an older man who studied in China, studied all this stuff, and he sits there and says, Western medicine is great. You take Eastern medicine, you add it to Western medicine, and that's when you see the effect. And that was a big reason for looking for a place like this to do it, is I didn't want someone telling me, oh, throw out all your Western medicine and just go from here, because I have helped many animals with Western medicine. But then there have been animals, especially these chronic sick ones, that we do through everything we can at them, and we just still can't get there. And then all of a sudden you throw Eastern medicine on top of it, and all of a sudden you're like, oh my God, we're seeing changes. We're seeing quality of life improving. And I think that's a big part of it. But you don't have to wait until you hit that point to look for those options. And I think that's the failure of both sides, is you have too many people that only believe in their way, instead of saying, hey, both of these can be helpful. And if we meld them together like this, you all of a sudden have a patient that's healthier, an owner that's thankful and happy, and everyone wins.
What do people misunderstand about acupuncture because of that? Who is the best veterinary partner for someone who's seeking that for their pet?
I'll go two ways on it, and you can take both extremes on it. The misunderstood thing about acupuncture from people who don't believe in anything other than Western medicine is that it's pseudoscience and it doesn't work at all. From the other side, you have people who are really, really skeptical of anything that Western medicine, because of the big business of it, and thinks I can only go this way. And I think both those people have something to learn. Extremes on either way are never going to be good. And so I would argue the people who say there's absolutely no proof that acupuncture works, you can do a PubMed search on peer-reviewed articles. And now the big thing, especially on the veterinary side, is to actually have more grants and more money into doing true blind studies that shows that acupuncture helps. From the other side, saying, I can only do holistic medicine, I can only do alternative medicine, I would say, hey, you may be doing a really great job, but don't you think it'd be better if we're able to put them together? Who you need to work with, you need to have trust with whoever you're doing with. So you will have some practitioners like me who can do multiple of these modalities and do it together. You don't need necessarily one person to do both. There are plenty of acupuncturists and Eastern medicine doctors that will be, hey, I'm going to help you this way, and I'm going to give you a list of things that I want because I don't do this, but I want your Western doctor to do. And there are a whole bunch of people that are on that road. People think that everyone that does acupuncture has no belief in Western medicine and vice versa. And the truth, that's not the truth. You need to find people that are willing to work together, whether it be your acupuncturist or your full Western medicine doctor. If they will basically not take any look at combining the two, then that's not going to work for you if that's what you're looking for. So you need to make sure that you find someone that believes what you believe, which is, I want to try both of these things together and I want to see what we can do. Because even the Eastern medicine person who is like, you have to stop all your drugs, well, that's not fair either if you're not ready to do that. And so I think that's the big part of it. Yes, if you have someone who can do it all at once, that may be easier for you, but you don't necessarily need to seek that person out, especially if you're somewhere where, hey, you may not have someone who's doing integrative medicine. But if you find, and there's a lot of places where you can find, whether it be a house call or an actual in a practice Eastern medicine, and they have a partner as a Western doctor and says, hey, they're going to do that stuff, we're going to do this stuff, we're going to send records to each other and we're going to talk. And so I think if you're interested in these modalities, you need to make sure that whoever you're working with on either side of it is going to be respectful, accepting, and also collaborative with the person doing the other side.
Is there a directory of doctors or veterinarians who do acupuncture and also acupuncturists who work with veterinarians?
Second answer is harder. That's something you probably find the acupuncturist first, and you ask those questions. There, if you go to the Chi University, so it's chi.edu, so chi.edu, that is their main site for continuing education. Even they have a clinic down in Reddick, Florida, but they have a link on the bottom that says find a vet. And they actually have a list. You can put in your zip code, you can put it there. They have a list of people who have completed their courses but not finished their certification. They have people who have completed the certification, and then they also have their other certifications. So you can find a certified Chinese herbalist. And then there actually is a new master's program through them that is integrative medicine. And so they're actually looking at doing the Chinese part, the food therapy part. They also have what's called Tunai, which is, it's massage. It's basically medical massage, but when you see pictures of them doing it to the cats, it's really funny because the cats are stretched out. It's very cute. If you ever see a picture of it, you'll laugh because it will make you happy and smile. But they do all this stuff. And so it's actually taking a lot of the Eastern medicine specialties together. And so there are people who've done that master's program or done, multiple certifications. And so that list is at least where you can start to find someone from Eastern training. And then at that point, it's probably emails or phone calls and saying, this is what I'm looking for. Are you willing to help me with that? And again, if you're looking for just the Eastern perspective and you find someone who can do that, and that's what you're happy with, that's fine. Like I said, and I've seen really good success rates with that. But if you're looking for someone there to work with now someone who also on the Western side, there are plenty of them. And I've met a bunch of them all over the country. It's not even just in New York. I can't help in Australia right now, sorry. But I know there are people certified in Australia. I just don't know anyone there right now. But you can certainly find someone. If you go back to probably 1980, a lot of people getting certified in acupuncture wanted to completely get away from Western medicine. That is not where it is right now. I was just in this class with 100 and something other people. 99% of them were looking to integrate. They were not looking to just do one or the other. And so I think it's a lot easier to find someone to work with you and work hopefully with your veterinarian from the Western side to find something that works for you and hopefully making your pet more comfortable.
Thank you for sharing that. And for the folks who are in New York, I know Kate is in Australia, but Australia actually has great veterinarians. But for the folks who are here, and I know a lot of the folks here are in New York City, if they wanted to get in touch with you, what is the best way to do that?
We have 4 practices. So we have our West Village Veterinary Hospital, Tribeca Soho Animal Hospital, Seahort Animal Hospital, and Battery Park Veterinary Hospital. I split my time between our Battery Park office and our West Village office. It's essentially 50-50. I mean, it is something where you can certainly make an appointment there. They're all downtown Manhattan, but they're all pretty close to each other. Battery Park's a little more scenic because you get to see the Statue of Liberty outside our door, but it's also the smallest of the 4 practices right now. West Village is our largest, but it's something we can do there. You can contact me there. You can make appointments online. You can call, make appointments. You can certainly email as well. If you have any questions, more than happy to answer them to the best of my ability. I always warn people that it becomes legal stuff where if I have never seen your pet, I have to be very vague in my advice because I am not allowed to diagnose something I've never ever seen. That is both for your safety and your pet's safety because I may not have all the information. I could give you the wrong advice, but it's something that any type of questions for that, we could do that. Yes, if you're interested, I'm more than happy to do it. Like I said, I really have become very passionate about this, and I do think I'm seeing many cases where we were hitting the wall the other way, and now we're seeing a lot more results with it, which is great.
And I think, Dr. Berg, you have convinced me to bring in my dog. So yeah, because I think I had always, well, not always, in the past few years, had that perception that this was mainly for end of life hospice type care. And based on what you're telling us today, that's been really eye-opening to, especially because if you have a rescue and you don't know their past history, unfortunately, when stuff happens, it's really hard to, if it's gone too far, it's really hard to come back from it. And that has been my experience in the past. So I will be attempting to use this as a preventative modality for my dog, for sure. So Ingrid says, given that there are various conditions, can you say if there is an average number of visits?
3 treatments is probably the bare minimum. Make sure you see a response. More times than not, I'll tell people 5, but they're not necessarily going to be weak. When I first start on most conditions, I will say, okay, for the first 2 or 3 sessions, they're probably going to be once a week. And part of that is on the first session, we also don't want to overload them because in the process of stimulating the points, if you do too many points initially, you sometimes will make the patient very tired and quiet for a couple days. There are instances, I've never seen it, but I've also really scared after they told me this, is that especially on an older patient, if you try and hit them with 30, 45 needles that first time, the owner might call you the next day, be like, oh my God, the dog can't get up. It's really tired. And that's because you're overstimulating them. So especially on older patients, you want to start off with a lower amount of points initially, and then kind of work your way up. And so the big thing we end up seeing is, for me, when I get that Chinese diagnosis, we're going to start treating the initial diagnosis we have. But that diagnosis is going to change. And again, without going too much into the weeds, as you get more chronic, you actually go down levels. So most things will start out with something called Qi deficiency. And then if it's untreated, it will become a Yang deficiency. And if untreated, it now becomes a Yin deficiency. And so you have to start treating the Yin deficiency, which then after you treat enough becomes a Yang deficiency, which will actually look different. And so now you may be treating the same Western condition, but now you're going to change your points once you get to that point. And then all of a sudden you go back up and it becomes a Qi deficiency. Now you're going to change again. The amount of times on the ones that I've been doing for arthritis, I will say by that 3rd or 4th visit, most people are seeing enough of a response that now we're extending out that time. And so the next visit, we might say, okay, let's do it in 2 weeks. Then if they're really doing well, we go to 3 weeks. And once you correct some of these underlying things from the Chinese perspective, now you're actually going to have a situation where for maintenance, maybe they're fine for months and then they have a flare up and they come in for 1 or 2 treatments and then they're good again for a number of months. But I think initially you need to commit to that 3 to 5 treatments to see if you're seeing a response. And then depending on the condition, depends on how often we need to do it. Arthritic dogs, unfortunately, are never going to be not arthritic. Arthritis is not reversible. It's only manageable and treatable. And so, and this goes the same way, whether you're using a non-steroidal like Rimadyl or acupuncture. And so, but the good news is with acupuncture, you hit a point where now that those breaks become longer and longer and longer. And now you still may be using other medicine to help it, but now they're doing really good for a while. And then a month might go by or 6 or 8 weeks might go by. And you say, hey, you know what? I'm noticing something again. You come back in, do another treatment, and maybe that lasts another 6 or 8 weeks. On, the more chronic stuff, whether it be allergies, whether it be inflammatory bowel disease, whether it be kidney disease, that's going to be a little bit different. An animal with kidney disease, whether it's a dog or cat, again, you're never curing that. You're basically just trying to treat it. So you're trying to get to the point where you do that. The one thing I will say is that if you are interested in Chinese medicine, alternative medicine, you can sometimes see an even bigger effect if you do Chinese herbs plus the acupuncture. Chinese herbs, I know this talk isn't about that, but Chinese herbs are a little harder because if you do the wrong Chinese herb, you actually can do damage. That's why you have to follow them a little more closely. But it's also really important to get that Chinese diagnosis right. And most of the Chinese herbs are not forever. You do it until you treat that Chinese diagnosis and you either switch or stop. I have dabbled in a little bit because we did do some Chinese herbs in the class. And so I have used a little bit of it, but I by no means very comfortable with it. I'm using kind of the more commonly used ones for certain things, but I do know a lot of people who are certified in acupuncture do use a lot of Chinese herbs as well. But those are other things to do. So Ingrid, again, I'm sorry every time you ask me a question, it's a little more vague than a yes and no, but I hope that is enough for a basis of it. And you can tell me no. If you tell me no, I will try and answer better.
For reactivity and anxiety, have you seen acupuncture being effective? And again, how many sessions? Is it like an ongoing thing?
I have seen it. I have used it. I will tell you, acupuncture alone for anxiety, while it can help, is probably not enough by itself. I do think if you combine the Chinese herbs and the acupuncture, you are going to have the better effect. We have another doctor, Dr. McLaughlin, who we joke is a magnet for behavioral dogs. She now had a dog in vet school that she got when it was a puppy, became a basket case, and basically had to deal with all types of behavioral modifications. And then after that dog passed away, she was so careful looking at rescue groups, trying to find a dog. I'm not going to have a behavioral dog again. Of course, she got another dog that within a week, she's like, oh my God, I did it again. I tried to do some acupuncture, but again, because she has a dog that has a lot of anxiety, it's not easy to get the needles in that dog. So it's hard. But we have started some Chinese herbs on her dog, and she has noticed improvement. Now, that dog has been on Western pharmaceuticals for behavioral stuff for a while, but she was actually skeptical, but she's like, I'm willing to try. And she actually has even told me the last couple of weeks, she does think it's helping. I think that's a lot of way to go with it. Doesn't mean, the acupuncture is certainly something that's great, but so many of those anxiety dogs are not necessarily going to be great because a lot of the points we end up doing are going to be around the head and ears. Not a great spot to get into. And then most of them have to do, and again, we didn't go into a lot of this, but we talk about organ systems in the Chinese kind of diagnosis stuff, behavioral problems are actually under fire or heart. And so you're using a lot of fire points, which can be on the legs and here. And again, a lot of these anxiety dogs may not let you get to those points so well. It is certainly something we can do, and you can see response of it. But with the acupuncture with those dogs, if we don't do it weekly for a little while, you're probably not going to see the full effect. And the question is on those behavioral dogs, how many of them are going to let us do that? It's hit or miss.
I can only speak for New York City dogs. It is a tough place, especially if you have anxiety already. And Josie, like you, I've used acupuncture personally and has been helpful. So definitely a proponent. Thank you so much, Dr. Burke. This was great. So helpful. And thank you for all the detail.
Like I said, I was like, I'm trying not to be too nerdy about it, but I hope it came across. I really do enjoy it. I really do believe in it. And like I said, if anyone has any questions, I am more than happy to answer them. Like I said, caveat being, if it's a specific question about a patient I haven't seen, I legally just cannot, and that's to protect you guys too, but more than happy to answer any questions I can help. If you are somewhere else and you're looking for someone does acupuncture, I can help with that list. So awesome. If you go to that website, you go down the bottom in one of the scrolls, it says find a vet, and they have all basically the ones who've completed any certified veterinary acupuncturist. So if it's with another program, they have them in there. And so it's a really nice thing. There also is a World Acupuncture Society, Veterinary Acupuncture Society, and that's another good thing for people like Kate in Australia. Unfortunately, I wish I could tell you it's a magic pill that can keep every dog alive forever, but it's really about giving them the best lives, and I think it can be helpful. And it sounds like you had that experience as well, which is great.
Thank you so much again, and thanks everyone for joining.